I had someone ask me, why do I only suggest the pacing defibrillator analyzers every time I recommend one? Well, we're going to cover that coming up next, right here on Better Biomed. What's up, everyone? Welcome back to Better Biomed. Today, we're going to be talking about pacing, and that is because I have recommended many times to people that they should only have a pacing analyzing defibrillator analyzer, and that is because modern day defibrillators, and I hesitate to put my hand on this guy right here, but it is technically a modern day defibrillator, is biphasic. It does have pacing, and it also has regular fibrillation, and it also has a automated mode where it acts like an AED. However, any defibrillator that's going to be used in a clinical setting is probably going to have pacing, and that includes EMS, first responders, etc. And that is because pacing is the actual controlling of the heart. A lot of people think that up here, defibrillation is the controlling of the heart, when actually defibrillation is when your heart is sitting there and it's quivering. That is fibrillation. And when it's fibrillating, that's when the heart is quivering and it has an irregular electrical signal. And what we want to do is reestablish a baseline and reset it. And that's what you're doing. You're injecting and pulling out voltage across the chest cavity. And that hopefully resets the heart and allows it to establish a normal QRS complex. But it doesn't always happen. In fact, actually, a lot of times the heart will beat too slow. Or it tries to go into a systole, which means the heart isn't beating at all. And if that happens, then we have to move to pacing, guys. And pacing is a controlled, extremely controlled discharge of electricity across the chest cavity that stimulates the heart to pump. So we're controlling how hard it beats with the current and also the rate. And also the current is going to be based on the anatomy of the patient, because sometimes patients are rather large and you have to up that current because you want to inject that current across the cavity of the heart in order to stimulate it to pulse. So it's kind of like a TENS unit and it's stimulating a muscle, but we're doing it under a very regulated setting. And that is why we need a defibrillator analyzer that can monitor and measure pacing. So here we have a segment of a defibrillator and we have to test it, and it's under very strict tolerances. So we have right here, let's go ahead and set this guy to 60. We're going to go ahead and set the current to 10. You can hear it clickety clack right there. Now there's two types of pulses that are going to be given by any defibrillator. There's synchronous and asynchronous. And that refers to the heartbeat and when or if it needs to pace. Now, synchronous is when this guy right here is reading the heart rate, which I have up here some ECG leads. And what we are doing is if we set this guy for 60 and over here, our patient is beating at 70, so it's above my threshold, then we don't need to pace. And you'll actually see that little pulse right there disappear. But if it's asynchronous, that means I don't care what that patient is. We are going to get him hot and now, because sometimes patients, their heart is failing. So yeah, it's working one moment, then the next moment it's not. So what we're going to do is we're going to put him on a regular cardio rhythm, and we're going to put that to asynchronous, which means I don't care what the patient's heart is doing. We are going to tell it when to beat. And that's when you move over here and you go into asynchronous and you set that up. Most defibrillators are set for synchronous, and most defibrillator analyzers default to synchronous when we're going to measure. And it's actually pretty simple, these tests for defibrillators. So you can see right here, my patient's set at 60 BPM, and we are currently giving a pulse. And if we come over here, we can measure that 60 ppm right there. And also you can see, this guy's shooting a little bit high at 13 milliamps. So that's what it's measured in, is milliamps. So let's go ahead and turn that guy all the way up. It should go up to like 200 milliamps. Woo, this guy's smoking right about now. That's a lot of current going in there. 200 milliamps doesn't sound like it's a lot, but remember, all we're doing is stimulating the heart. And you can see right here, we have 210 milliamps and we're still sitting at the 60 ppm. Let's go ahead and turn that up because What if it's a baby? What if it's a child? Children, their heart beats at a much higher rate. And you can see I am up there at 170 ppm. My defibrillator is at 170 and I'm sitting at 200. And this guy is shooting a little bit high. You can see I'm sitting at 209. It's a 212 right there on the milliamps. So that's how we would test this guy for synchronous function. Let's go ahead and turn this guy down to 60 and let's turn the current down because that's just a little bit high. Let's turn it down to 10. I like 10. All right. Now let's go ahead and let's test this guy out. So let's hit the range. And now we are back into defibrillation mode. And now I want to activate the ECG up here on these posts. And in order to do that, we're going to come down here to ECG waveforms. I have it currently set for 60 BPM. And from this point, we now have a QRS complex again. But notice how this QRS complex right here, it is pulsing on the QRS. You see that? So we're receiving a pulse at the same time as that. Now let's go ahead and let's turn our rate down 50. So when we turn the rate down, notice how my QRS goes back to a normal QRS. There is no pacing pulse there because we're on synchronous mode. And that means I want at least 50 pulses per minute or 50 BPM. So on my patient side, if I turn it down, then this one here will start pulsing all over again. And I can simulate that by just turning up my demand. So right here, you can see my pulse and my QRS. I'm telling it that I want my patient's heart to beat at 70 beats per minute. So I'm giving it 70 pulses per minute. And over here, you can see that I have it currently set up for outputting those. And I can change my BPM. Let's go into choices and let's go to 80. Enter. And ta-da! You will see my BPM go up, which it surely is. And you can see down here saying demand at 70 and my pulse disappeared. So that would be a successful test on that part. I'm not doing it according to the book, but you get the gist of what I'm trying to accomplish here. Let's go ahead and let's exit. Let's change our range back to pace. And now we are over here and we are measuring paces again. Again, we should have 10 milliamps at, let's turn it to 100. I like 100 because that tells me a easy round over percentage. And I have 100 ppm on the dial and it is shooting a little bit high. You can see I'm hitting that 12 milliamps right over here. To be expected, this poor guy is definitely out of calibration, but who cares? It's not for patient use. You get the gist. Anyway, guys, that's just a quick rundown. And if all these modern day defibrillators are having pacing, then we should be able to maintain those defibrillators correctly. And that means having the correct test equipment. Having a pacing enabled defibrillator analyzer is an essential tool for a modern day biomed. And that is why I recommend it. So remember, folks, for pacing, that is normally when you have bradycardia and the heart is slowly beating or asystole. It's not beating at all. That's why we pace, because we're giving the patient a demand of how much their heart is going to be hitting because they need a certain amount of blood flow based on their anatomy. Now, if they have tachycardia and heart is just sitting there quivering, going really fast, and it can't establish a normal sinus rhythm, that is when we are going to defibrillate. All right, so there are two sections of a defibrillator. It's that way on purpose, and that's because there's a variety of cardiac conditions that a modern day defibrillator is designed to treat. Thanks for watching, guys.
I'm here to assist you with all your test equipment needs, from multimeters and test weights to patient simulators and x-ray analyzers. If you need guidance or you have any questions, please don't hesitate to write me at jbarber@bcgroupinternational.com.
If you enjoyed this video, don't forget to give it a thumbs up and subscribe for more content. I'd love to hear your thoughts, so drop a comment below with what you'd like to see in future videos.